Okay, in this section we are going to be talking about the anatomical body positions. These notes are due on Tuesday. So the person that you see here is standing in what is known as the anatomical position. So the body is standing up straight, the palms are facing outward, the thumbs are pointing away from the body, and the feet are facing forward. Now it's important to stay in anatomical position because this is how, when you're talking about directional terms, if the body is not in anatomical position, then the directional terms can start to become confusing at that point. So directional terms are really important because no matter what you're talking about, if you can use directional terms, it allows you to be able to place where something is, and it's consistent across all anatomy. So no matter what you're talking about, superior is always superior, inferior is always inferior. And it's a lot better to use these than to use vague terms like up, down, front, back, because what is up or down is all relative depending on what you're talking about. So inferior and superior mean toward or away from the head. And it's important to remember those specifically so that when you're asked something, you need to refer to it in terms of where it is with respect to the head. Posterior and anterior. Posterior refers to the back of the body, whereas anterior refers to the front of the body. Medial versus lateral. And then you have intermediate as well. So the midline of the body goes straight down the middle. Medial is towards the midline. Lateral is away from that midline. And then intermediate can be somewhere in between that. Proximal is closer to the origin of the body part, and distal is away. Typically, these are used in reference to limbs, so arms or legs. You're not going to use proximal and distal if you're talking about something within the torso. So it's only having to do with limbs, arms, and legs. So something is towards the origin of the body. So if we're talking about legs here, the origin of the body is right there at the hip. So whatever is closer to the hip or the pelvis is proximal, and the farther away from you are to that origin is distal. You can also, one exception is when you're referring to the vessels. So vessels, the origin of the body is, we're going to consider it the heart, but as you're talking about arteries and veins in the arms and legs, you can use proximal and distal for those. Superficial and deep, this can kind of be the most confusing, but superficial is going to be towards the body surface, whereas deep is away from the body surface. So this is you don't have to write down this entire chart. This you can find in your book. But this is kind of a summary of some other. You have superior, inferior. You do have ventral and dorsal on here. Medial, lateral, and intermediate. And you can kind of see the arrows as they're referring to it. And then this column is giving you some examples of how you would say that. For example, the head is superior to the abdomen. The navel is inferior to the chin, and so on. And here we have proximal, distal, superficial, and deep as well. This slide is missing a picture. Don't worry about copying these down. We will have a worksheet in class where we will be copying these down, so don't worry too much about this slide. Same thing with this slide. Don't worry about copying these down. We'll do this in class. But these are, even though the words are messed up, these are some terms that we'll be studying in class as well. Okay, on to body planes. So whenever you're discussing a body part, typically or body planes, you're talking about how the body is divided up. So you can have sagittal, which divides the body into right and left parts. Mid-sagittal is the sagittal plane that lies on the midline, so that line that goes straight down the middle of the body. A frontal or coronal body plane divides the body into the anterior and posterior parts. So if you remember this from the directional terms a minute ago, that's the front and the back. Transverse divides the body into superior and inferior parts, and then oblique cuts are cuts made diagonally. So here is a picture you can kind of see. The transverse is going here along her waist. The frontal plane is dividing her into front and back, or anterior and posterior. And then here is the median or mid-sagittal plane, which is going straight down the middle of her. And you can see she's standing in anatomical position. It's important to remember that not all humans are exactly alike. Everybody slightly varies in both internal and external structure. So over 90% of all anatomical structures will match textbook descriptions, but certain things like nerves and blood vessels might be slightly different in one person versus the other. Small muscles might not be exactly the same in one person versus another, so there can be variations. And of course you can have extreme anatomical variations, such as extreme deformities or other variations that's going to make one person very different from the norm.